On to our first speaker. In keeping with our theme of PPI as partners in research, it now gives me great pleasure to introduce our first speaker, Dr. Avril Kennan, who is joined by Dr. Frances Drummond, Dr. Nikki Dunne, Dr. Claire Kilty, Cíara O'Reilly, and Lora Ruth Wogu, who are reflecting on health research charities' experiences of PPI. Dr. Kennan will then join us live for a Q&A session, so please enter any questions or comments in the chat function. Thanks.
Hello, my name is Avril Kennan. I'm the CEO of Health Research Charities Ireland, HRCI. Thanks to the organisers of the annual NUIG PPI and Research Conference for inviting me and some of the HRCI member organisations to be part of this year's event. I got to have a chat with these fantastic women who I will introduce properly as I bring them into the conversation. I think you'll find their perspectives extremely interesting. So let's get started.
Hi, everyone. It's an absolute pleasure to take part in this conference that we've always really enjoyed. And we're here today to talk about health research charities in PPI. So it's an absolute pleasure to get these very PPI-focused member organisations of HRCI together. To have this chat, we've seen enormous growth in terms of PPI across all our member organisations over the last number of years, and a slowly increasing recognition of the really, really important role that they play in PPI. But there's also some challenges that remain, many challenges that remain. But we're going to get straight into it. I'm going to let them speak for themselves, and I've asked them to consider a couple of questions for today.
I lost my connection here momentarily, but the first question I asked them was, in terms of PPI, what has their organisation progressed most in recent years?
I'm going to go first to you, Nikki. Nikki Dunne is the Research Officer with Family Carers Ireland, for you to give us your thoughts on that.
Yeah, sure. Thanks, Avril. So Family Carers Ireland have been facilitating PPI in an informal, unstructured way for a number of years. You know, we always put carers forward to steering groups, commented on, you know, carers commented on patient materials and so on. But working with PPI Ignite and becoming a member of HRCI has led to the development and implementation of a more structured way of working. So in 2020, we established a family care, public and patient involvement panel, and we deliver training and capacity building for a small number of family carers interested in getting involved. And that has also helped us build capacity within internally in the organisation. And I think just to reflect on the impact of that, the feeling of empowerment amongst the panel members is a recurring theme. You know, they've reported that the training has given them the knowledge to recognise and vocalise best practice in PPI and speak up also if they feel that that best practice in PPI is not being met. So I think this is the most significant PPI activity over the last number of years, Avril.
Yeah, thanks a million, Nikki. Your progress in the last few years has been stellar. It's been quite incredible to watch, so well done on that. Lora Ruth, I'm going to go to you. You are the Chief Operations Officer with Sickle Cell and Thalassemia Ireland. What are your thoughts on that one?
Thank you very much, Avril. My thoughts on this are that PPI is very, very new to us as an organization. However, we found it very interesting, and we are learning on how to structure our group into making it more official. For the last few years since 2016, the organization has participated as representative on scientific advice with the European Medicine Agency on drugs for sickle cell disease, which we have successfully seen 2 drugs come out this year. And also we have been having a lot of our patients and parents participating in research with medical students and PhD students in RCSI and UCD, and that has really helped. However, we don't have a proper structure as an organization, and that's what we are working on, which has been helpful through our membership with the Health Research Charities Ireland.
Thanks, Lora Ruth. You know, it really is incredible what you're doing in a voluntary capacity. So well done on all the progress. Frances, I'll go over to you. Frances Drummond, you are the research manager with Breakthrough Cancer Research. How about things in breakthrough cancer research?
Thank you, Avril. Very much like what Nikki and Lora have said, we were Breakthrough Cancer Research Fund research into cancers that have the lowest survival currently. And, you know, we were working with patients in a very informal way until 2019 and set up at the first panel, which has about 80 members currently. And we used the HRCI workbook or for training, that training as the template, and really successful. We have run around 4 sessions so far. This is really, as the two ladies have said, really empowered patients, and also our organisation has benefited as well, because internally we needed to really embed what PPI is. It's not just people telling their experiences. It's a partnership. It's working with patients, not for them or to them, you know, it's working with them. And also that conversation with different researchers, especially the basic science researchers, you know, it's very important to keep that conversation going, that PPI has a value in all research at all different times. What we've seen is, what one particular person said to me that I will never forget, it has helped with her fear of recurrence, the knowledge that patients obtain during the whole process, going to seminars and webinars that we tell them about, you know, talking to patients or talking to researchers. And it's also helped them with their communication with their medical teams, which is another benefit, you know, really their confidence grows. So that's some of our experience, Avril.
Thanks, Frances.
Positive experience. We're coming to the rest.
Yeah. Thanks, Frances. That's a lovely example of a positive impact on an individual, because I think if PPI is done well and PPI contributors are supported, it can be a really positive experience for people who want to get involved. So thank you for that. Cíara, I'm going to come to you. Cíara O'Reilly, you are the Research Project Officer with the Alzheimer Society of Ireland, and you've also been doing great things over the last number of years.
Thanks very much, guys. Yeah. The Alzheimer Society of Ireland supports the members of the Dementia Research Advisory Team to contribute to research here in Ireland and internationally as co-researchers, as advisors. So since the inception of the Dementia Research Advisory Team in April 2019, these experts by experience, they've worked relentlessly to ensure that the voice of the person living with dementia, as well as that of family carers, is at the heart of dementia research. In their PPI capacity, the members of the Dementia Research Advisory Team, they share their time, their knowledge and their insights. When we consider what the ASI has achieved in relation to PPI in the last number of years, we really need only to look to the members of the Dementia Research Advisory Team. The girls, Frances and Lora Ruth and Nikki, they've already hit on it. The seeing the members flourish, like empowerment is the word that's come up. So the team has swelled in numbers to 18 now, a mix of people both living with dementia and family carers. And what never ceases to impress me with the members is their personal growth within the team. So whenever we speak about recruiting new members to the team, we'd often say, you know, there's no experience necessary. You don't need to have had an academic background to contribute to the research process. But looking at the team now, you'd be hard pressed to say that they look like they're new to the research environment. And that's because we support the members of the Dementia Research Advisory Team through capacity building work. I find people can be unsure initially, you know, maybe a bit hesitant to put themselves forward for a particular project, but we've invested time into the team, built our relationships and their confidence. And so we never just throw them in at the deep end. We take the time to get to know the members so that we can support them to engage in projects that they connect with or feel particularly passionate about. It's an absolute privilege to see the members commit to a project and not only embrace the work, but flourish in that research environment. At the ASI, we work hard to kind of honour this approach internally as well. So we've embedded the ethos of PPI in our work with the members of the Dementia Research Advisory Team. They contribute to funding decisions, they review research tenders, and they work with us to develop our new research strategy. We find that we try to take a very innovative approach to the work and what we offer to the team. So we're among the first to introduce a unique new project where the members of the Dementia Research Advisory Team will be running their own research study, from deciding on the topic right through to designing it and methodology and then disseminating findings. So very excited to support them, throughout this exciting new phase of their work.
Thanks a million for sharing that, Cíara. And, it's great to see. And again, huge progress in the last few years. And I know a lot of the other members of our PPI shared learning group in HRCI have looked to you to see how you've managed to shape that and all the work that you've done. Claire, I'll go over to you last, but definitely not least. Irish Cancer Society have been a leading light in PPI over the last few years as well. And you're the research manager with them.
Yeah, and similar to other partners on the call, we've very kind of similar backgrounds. So we're the largest voluntary funder of cancer research in Ireland. So we fund lots of patient-focused research, specifically in translational lab-based sciences, clinical trials, and survivorship research. And we really have worked hard since 2018 to try and embed the patient voice into our research process. Now it's great to see we have approximately 50 trained PPI contributors in the Irish Cancer Society. So these are people affected by cancer in some way, be that patients, family members, carers, friends. And all of these people are involved in the review of all of our research applications that we get in. So they partner with our scientific reviewers and help make an equal decision on who we should fund, which is great. And, one of the really brilliant things to see is that now a lot of my panel have been empowered and had the confidence to be cancer research advocates. Be involved and embedded within the research community, which, is really powerful to see this relationship between the researchers and the patients grow. It's definitely something that we in the Irish Cancer Society are very proud of our researchers and our patients that are so willing to work in partnership together.
It's been just a joy to watch that over the years, Claire. So well done on all of it. Now, we didn't want to leave people with the sense that this is all rosy in the garden. It's the same as for all others who are involved in PPI. This is challenging. It can be really hard at times for many different reasons. And so I'd ask the group here to think a little bit about what is the key challenge that they're facing at the moment now in 2022. And so I'm going to go to you all again to share a little bit about that with us. Lora Ruth, I'll go to you first.
Thank you, Avril. The biggest challenge is actually the fact that there is lack of diversity in research in relation to not just for sickle cell or thalassemia, but also other health-related issues affecting the migrant community. So as an organization, we are contacted by a lot of researchers looking for people of African or Black origin or Asian origin to participate in research, and encouraging our people, especially the Black community, to participate in research is quite difficult because they lack trust. So that has been a challenge, but it's something that we are committed to working on as an organization and also expanding into, as well as resources. As a charity that does not get any funding, we are lacking in resources, and that is also another huge challenge.
It's amazing what you're doing, because you're not only dealing with sickle cell and thalassemia with no income, you're also reaching out to these wider conditions. And thank you for that. I think, we all need your help, but it's also all of our responsibility. So we're going to have to get better at that as a wider community as well. Nikki, the key challenge for you?
I would say resources, Avril. So as PPI becomes more embedded and researchers want to do it well, we want to do it well, carers and the public want to do it well, but it does put additional strain on already limited resources within our organisation, and I know other organisations too. So it is really fantastic to have more and more interest and to be developing capacity amongst carers, but it is difficult to manage this alongside other competing priorities. So, I would like to do a lot more to drive carer involvement in research, but to do this and support carer involvement, but to do this involves pushing something to the side or pushing something out. So, and I'm not really sure if researchers understand that fully, that by giving our time to their project, as amazing as that project may be, it does come with a resource cost to the charity. So that's the biggest challenge I think that we're facing at the moment. And I'd like to echo Lora Ruth there as well in terms of diversity amongst our PPI panel. That's also on our radar.
Yeah. Thanks, Nikki. And you are speaking for all the member organisations of HRCI on that one around resources. So thanks for sharing that, because we do need people to understand our perspective in all of this. Cíara, what about you?
Thanks. Yeah, I suppose Nikki and Lora Ruth have both touched on it already. So I find a struggle or PPI challenge for the ASI is recruitment, recruitment of new members living with dementia, and in making sure that we achieve diversity and representation. We work very hard to ensure that we represent both sides of the research experience, so from a family caregiver perspective and that of people living with dementia. But of course, a diagnosis of dementia can knock the confidence of an individual. So the prospect of suddenly throwing themselves into something new, like our dementia research advisory team, it may be too much initially. But we continue to reiterate that this is a no experience necessary gig, and we will always support new members, current members, ongoing members of the dementia research advisory team to ensure that they engage with the research community in an honest and valuable manner.
Brilliant, Cíara. Thanks so much for talking about that challenge of recruitment, because that's across the board, I think, isn't it? Claire, you're a relatively well-resourced organisation, but that doesn't mean there are no challenges. How about you?
So like a number of our members here, we share a lot of similar challenges, resourcing, as you say, and we've also really struggled to get diversity and representation on our panel too. So that's something that we are actively working on. Another thing is, we build relationships and friendships actually with the people affected by cancer on our panel, which is very rewarding, but also very hard when these individuals get sick or their cancer reoccurs. At the start of COVID, one of our longtime PPI contributors who we all knew so well and did a lot of work for us passed away. And we found that actually very difficult, because you think you work in an organisation that deals with cancer all the time, but then when you build friendships with these people, it is really hard. And then I suppose another challenge that's come up more recently with some of the grant calls that we've been working on is trying to, I suppose, get buy-in and convince lab-based researchers in particular about the value of PPI within biomedical research. It is, for those researchers, they work in a lab all day, it can be very difficult to see the role of PPI contributor. So we really need to work on training these researchers to start a conversation and build their networks as early as possible in their research journey, and not just when the grant project is due. So that's what we're working on at the moment.
Brilliant, Claire. And that challenge of more basic research, is a very real one, and something that the PPI Ignite national network is addressing. And I think you're involved in that. So thank you for your wider contributions as well. And Frances, the last word to you. What is the biggest challenge that you face?
Yeah, so I agree with everything everybody says. I think as well as working on individual projects, getting patients embedded in individual projects with individual researchers, we have to spend a long time building the relationships and the confidence with our PPI members. And as Claire says, you become very close with these people, you get involved with them, and they do get sick and pass away, which is a big unseen challenge for us. But that relationship takes time, and it's an unseen task, unappreciated task, but essential task that we in the charity community really put the time into to encourage people to give off their time, because the PPI members are giving up their time essentially free. They're giving their experience, so they're giving up their privacy to a large extent. So and we have to respect that. I know everyone in this call totally respects that, but I think that needs to be said as well.
Fantastic, Frances. It's a very important note to end on, and I would just like to thank you all hugely for your time today. It's been great to have a chat, but also for what you do more broadly as well, not just today, because your organisations and the other members of HRCI have a really, really important role as what we would used to call the middleman. We will not call it, we'll call it the middle person now, just being a facilitator in it all, and often being PPI contributors yourselves, bringing a broad patient perspective and often facilitating stronger PPI, whether within our own organisations or with supporting the research community in that. So thank you all, and we shall leave it there.
Avril, I don't know if you're with us, but we have some questions.
Yes, I'm here, Martin. Yes.
Super, great, thank you. So I'll just start off with the there's one question here. How do charities monitor the PPI individual projects, or how might they to ensure PPI is delivered as described in funding applications? Is that something you've seen or experience of?
Yeah, thanks, Martin. Just to say, first of all, so sorry about the quality of the sound there. Maybe there was a different format. We should have done it in for Zoom. I'm not sure, but we will definitely make it available. So we will make it available ourselves and through PPI Ignite in Galway as well, if that's possible. And also just to say thank you for this fantastic agenda today. I'm sure there are many people who would like to say that to you. So can I just say that? Yeah, in relation to that one, I mean, I suppose it's a big question, isn't it? And how, I think that's something that it might be coming from the perspective of that charities are small funders of research. There's a bigger piece as well, where particularly in Ireland, where charities are possibly supporting more PPI across many, many more projects than they're funding. And you could talk about that one all day. How do we monitor that? How do we know it's good? One thing that's really important to say is that charities feel immense responsibility for the communities that they represent. And that plays into all aspects of engaging with the research community on PPI. So it's really important to be aware of. And then I guess it's asking the right questions from the start. And our members do, when they're supporting PPI in particular, they do ask a lot of questions about how this is going to be done, and are the people that are going to be involved going to be supported and respected, and so on. So then it gives them a good basis to monitor that over time. And they also tend to have close relationships with the researchers that they fund or support, which is helpful in that regard as well.
Super, that's great. We have another question here. As researchers, we know the importance of building relationships with individual PPI contributors. Can you advise us on how to build relationships with charity organisations?
Yeah, that's a good one, because relationships are really at the heart of it all, aren't they? So very simply, the vast majority of charities that are focused on health research in Ireland are members of HRCI. So pop onto our website, there's a list of them all there, and then just reach out. It really is about making an initial contact, making it early, ideally before it's time to submit a grant application that you want the support on. It's never too late. It's always fine to reach out at any point. But ideally, if there is a charity working in an area that's relevant to you, it's sending the initial email, it's picking up the phone, it's having the meeting, just like everything else. And I suppose to bear in mind that, look to the long term as well. The real richness happens when these relationships are nurtured over time.
Yeah, that's great. A question here from Robin. Very encouraging reports, but what are the clear wins in terms of improving policies and practice? That's a difficult question, right?
Yeah, so gosh, that could mean so many different things, but maybe just to, and I hope I am not missing your point here, Robin, but maybe just to pick up on something that I think came through in that video, where I was really struck by how they all talked about the value to the individuals who are taking part in research, to the individual PPI contributors, and how empowering and interesting and that can be, and that just doesn't just happen. I think, you really need the good structures and policies in place around PPI to make it an enjoyable experience. And I think that the reason that they all reported back positively on that was because they are doing that. They're really thinking about, okay, how do we make this a positive experience? How do we support people? How do we feed back? All of those things that we know are important in PPI.
And on the other end of the spectrum, so now that we're embedding PPI in all of this activity, do we see an impact on policies, do you think, say government policies or policies within institutions? Is that happening, do you think?
Yeah, that's a really topical one, actually, because we had a meeting of our shared learning group yesterday, our first hybrid meeting, and thankfully we all survived. We were talking about that. We were talking about impact, and we had Sarah Bowman and Michael Foley in from Trinity to join us in that discussion and to share their thoughts on this topic. And I think it's something that we're all grappling with a little little bit. You know, it's very easy to say, oh, well, you know, we had a successful grant application, or we held a conference, or but as we were talking about yesterday, it's really the so what of that, isn't it? And keep asking that question. So what did that impact anything in the end? And I mean, there are many positive examples of it impacting, of PPI actually getting to impact patient care often at the other end of the scale. You know, things like having patient involvement in the development of clinical practice guidelines, for example, where you're taking the evidence and you're trying to push that evidence into care, and you're having patients sit on a panel and they're saying, well, okay, you know, the evidence might say that, but that's not realistic in my life. And I've seen really good examples of how those guidelines are redirected to something more meaningful for patients. So yes, there's many examples, but I think we all need to get better at thinking about what that impact might be from the start, and particularly the different perspectives that researchers and charities or patient organizations can have on that, you know, where the researchers might be a little bit more focused on publications and the charity might be a little bit more focused on, well, what does this mean to the people I represent, and bringing those together early on so that you're more likely to have a positive impact at the end.
Yeah, I think it's a hard one to solve, you know, speaking as an academic, but I suppose it's creating these kind of like virtuous circles that what benefits one benefits the other, and you know, so I think that's important. There's a question here from Paula. As patient organizations can sometimes collaborate and receive funding from pharmaceutical and medical device industry, are there mechanisms in place to protect PPI from undue industry influence?
Yeah, that's good. These are big questions today. So we actually have a template, a policy for our member organizations to use around their engagements with industry. So, you know, because there is at least the potential for undue influence in there, whether it's research that they're funding or PPI elements. So it's something that we do talk amongst ourselves about at times, the importance of just making sure that you're always working to represent your community and not being influenced by commercial interests. Having said that, we think it's really important that there is more PPI and industry-led research. And we actually collaborated with an equivalent shared learning group over in the UK called the Charities Research Involvement Group on some guidance for charities around supporting PPI and industry-led research. And that is also up on our website. Please get in touch if you're interested in that topic and you can't find it. But it's really about all those the tricky aspects of making sure that it's done well, and that the needs of the patients are to the fore in it all.
Yeah, I fully agree. So we've started in BioInnovate started embedding PPI in our industry training, and it, you know, you could see it as a threat, like you know, you're bringing in industry funding, but also it's a huge opportunity for patient and public voice to be heard within that forum. So I think it's an opportunity as much as anything else.
And Martin, just to add that I don't think we're doing enough of it in Ireland, actually. Not nearly enough in the industry side. But you know, we've all been talking a lot about the academic side and not enough around the industry side.
Fully agree. I think we're on time there, Avril. So just to say, really appreciate your time. I think you've been very generous and very clear in your answers, and it's been great to have you here and learning from you and from your panel. So thanks again.
Thanks so much, Martin.